Expedia and Visit Scotland invite you to come experience the beauty that awaits in Scotland. The sweep of wild coastlines, quiet lochs, and untamed landscapes. Fresh cuisine that feels rooted in the land. Come experience the kind of stillness that stays with you long after you leave. Plan your Scottish escape today at expedia.com/Visit Scotland.
LinkedIn Hiring Pro can't predict the future, but it can help you feel confident about future hires. Because Hiring Pro combines real-time insights and candidate data from the LinkedIn network with the criteria you've set for your role to deliver you a list of top-fit candidates. Businesses who use LinkedIn are 24% less likely to reopen a role in the next 12 months. Hire right the first time with LinkedIn Hiring Pro. Post a free job today at linkedin.com/quality.
When diabetes injures the retina, it causes blurred vision or blindness, and it's more common than you'd think. About 10 million Americans have diabetic retinopathy.
Wow.
Almost half of people with diabetes will get diabetic retinopathy. You can get an eye exam from an optometrist or an ophthalmologist. If you have serious diabetes, you're probably best with a retina specialist who have more advanced training in this, but getting the dilated exam is really important. And I think it's also important to tell that eye doctor, I have diabetes, so that they're looking in the right place in order to discover the problem.
Hey everyone, this is Jonathan Marks from Go to Health. I hope you're having a great day. November is Diabetic Eye Disease Awareness Month. Nearly 40 million Americans have diabetes, and about half will develop diabetic retinopathy, the leading cause of irreversible blindness in working-age adults. The condition often develops quietly with no early warning signs, which is why regular dilated eye exams are so important. But many people still don't recognize the risks. A survey commissioned by the American Society of Retinal Specialists found that nearly 2/3 of adults 40 and older did not know that spots or floaters can signal diabetic retinopathy, and more than half were unaware that high blood pressure raises the risk for vision loss. Retinal specialists are uniquely trained to diagnose and treat diabetic eye disease, and new therapies are helping patients maintain vision longer. Dr. Geoffrey Emerson is here to discuss how people with diabetes can protect their vision, when to see a retinal specialist, and what new treatments are improving outcomes for patients. Geoffrey Emerson, MD, PhD, has clinical interests including diabetic retinopathy, epiretinal membranes, macular degeneration, macular holes, and retinal detachment. He's board certified in ophthalmology and a fellow of the American Society of Retinal Specialists. He's the president of the American Society of Retina Specialists and an adjunct professor of ophthalmology at the University of Minnesota. Before we get to Dr. Emerson, we're building a community of people who really are interested in preserving their own health and maximizing it. If you like what we're doing, please give us a 5-star review or a thumbs up on Apple, Spotify, or YouTube, or wherever you're listening to us. It helps get the word out. Thanks in advance. So welcome to the show, Dr. Geoffrey Emerson. How are you today?
I'm great. Thank you, Jonathan.
Good. So we're going to be talking about diabetic retinopathy, but before we do, I wanted people to understand a little bit more about the eye. Tell us, what's the retina? What's the cornea? Give us a little lesson on that first.
Okay. The retina is at the back of the eye. It's a thin, very delicate tissue. It's the light-sensitive part of the eye. So it's very important for vision. And if there's any damage to the retina, it results in blurred vision or blindness. The cornea is at the front of the eye and the retina is at the back of the eye.
So what is diabetic retinopathy and why is it such a concern for people with diabetes?
When diabetes injures the retina, it causes blurred vision or blindness, and it's more common than you'd think. About 10 million Americans have diabetic retinopathy.
Wow.
Almost half of people with diabetes will get diabetic retinopathy. We want to detect diabetic retinopathy early so we can prevent the vision loss.
And how do we get early detection? What's the secret to that?
In the beginning, there really are not any symptoms. So getting periodic dilated eye exams is important to detect the problem. It's not till later in the disease that a patient might actually notice the problem. They might notice blurred vision or difficulty reading or floaters or shadows in the vision. If you have diabetes and you can't remember your most recent eye exam, you should get one. If you're starting to notice symptoms like the blurred vision or floaters, then you really should see a retina specialist because they have some advanced imaging tools in their clinics to diagnose and evaluate diabetic retinopathy. There are several options for treatment, and we retina specialists can help with the treatment.
If I do have diabetes, can I just go get a dilated eye exam from any eye doctor, or should I really be talking with a retinologist first?
I think you can get an eye exam from an optometrist or an ophthalmologist. If you have serious diabetes, you're probably best with a retina specialist who have more advanced training in this, but getting the dilated exam is really important. And I think it's also important to tell that eye doctor, I have diabetes, so that they're looking in the right place in order to discover the problem.
How does diabetes affect the retina?
Diabetes injures blood vessels, and if a blood vessel leaks or grows where it shouldn't, the bleeding can cause injury to the photoreceptors. When it's really severe, it can actually pull on the retina and cause a retinal detachment.
Interesting. What new treatments and technologies are helping patients?
Thanks to researchers, lots of great treatments, but they fall into three main categories. There are eye injections where we put medicine into the eye. That medicine helps the blood vessels, like I mentioned. There's also laser treatment and there's surgery. Most people with diabetes are getting the eye injections, usually every 1 to 2 months. There are clinical trials going on that are looking at longer lasting medications so that the injections can be less frequent. And there's even some new studies looking at implants and also gene therapy that are longer lasting yet. So that's pretty exciting, I think.
When you say implants, tell us what you mean by that.
There's an implant made by one of the companies that's about the size of a grain of rice, and it's filled with a drug that slowly diffuses into the eye. It can be refilled every 6 months or so.
I see. And do we have a name for that?
It's called the port delivery system.
Great. Good. If we want to learn more, where can we go online?
There's a great tool on the website. Go to cforalifetime.org.
cforalifetime.org. Good. And you're part of the American Society of Retinal Specialists. Tell us about that organization.
It's a great organization. We are about 3,000 retina specialists worldwide. This is by far the largest organization. Our mission is to educate ourselves and protect the public who have retina problems.
Great. So again, if people want to learn more, go to cforalifetime.org. Now, doctor, if I do want to find a retinal specialist, how do I go about doing that?
There's also a tool on that website.
Good.
You can type in your zip code and get connected with a retina doctor.
Great. Doctor, we're at the end of this interview. What question didn't I ask that I should have, or what big message would you like to leave people with today?
Well, I'd just like to remind people to get your eye exams at least yearly if you have diabetes, and check our website if you need more information.
Good. Thank you for being with us today. It's been really helpful.
Thank you.
We've been talking with Geoffrey G. Emerson, MD, PhD. He's got clinical interests in diabetic retinopathy, epiretinal membranes, macular degeneration, macular holes, and retinal detachment, as he mentioned before. He's board certified in ophthalmology and a fellow of the American Society of Retinal Specialists. Dr. Emerson is president of the American Society of Retinal Specialists and an adjunct professor of ophthalmology at the University of Minnesota. Again, doctor, thanks for being with us today.
Thank you.
This has been Jonathan Marks with Go to Health. And as we say at the end of every show, go to health. We'll see you again next time. Bye-bye. Thank you for tuning in today to Go to Health. You are one of almost 10,000 people per day who enjoy the evidence-based health information offered by our guest health experts. You can watch us on our website and YouTube and listen to us on 8 podcast networks. Be sure to join Jonathan Marks in our upcoming shows each week. If you like our show, please share this episode with your friends and colleagues. You can subscribe to the show, join our email list, send us feedback, browse through the online store, and view our library of over 150 shows at gotohealthmedia.com. See you next time, and remember to elevate your life with Go to Health.